Hi, my name is Rachel Trobman. I'm the CEO and co-founder of StartUpHealth, where we're transforming the way that chronic pain is assessed and treated. When I was 17, I was diagnosed with a complex chronic health condition, joint pain, inflammation, all the like. But I was at a unique, albeit kind of unfortunate advantage in that my mom has lupus and my brother has cystic fibrosis. So I grew up in a family where navigating complex health conditions and working through complicated health systems is kind of the norm. I had great access to care. And yet even with all of those so-called advantages, I found a real pain point in pain care. And that's just because so much of it is so subjective. You know, how you ask 1,000 people, 10,000 people what their pain is like, and you will hear 10,000 different answers, and clinicians and health systems will hear it in 10,000 different ways. And so until you can create a shared language around pain, it's really hard to create the best care. And I think that that's also amplified as a problem because there are so few pain specialists. So there is less than one pain specialist for every 10,000 chronic pain patients. So there's very few people who are trained in understanding the complex nature of your pain. And so the average person is not able to correctly communicate around their pain and get the right care. And the average clinician isn't trained in delivering that care. And the pain specialists are overwhelmed with their ability to deliver the care that you need. Well, I mean, as somebody who is a patient, right, I've experienced firsthand the challenges of having the tools in which to correctly communicate and manage my pain when, you know, the majority of the time you're in pain, you're not in the care of a doctor. I think that then I was really skilled at building products, soup to nuts, that people love to use. That was, you know, my background is in building digital products. And so I felt like I could combine the best. But also as a former journalist, truthfully, I was really good at asking questions of people. And so I was able to speak to hundreds of pain specialists, primary care docs, other specialists, and identifying the overlaps and quickly synthesizing how we could create something that could develop meaningful change, transformative change, some may say, and I was excited to be able to do it. Yeah, so what we created is what we call a solution as personal as pain itself. It's called Branch. It's reimbursable software that clinicians and health systems introduce through their EHR or healthcare delivery system to their patients. And their patients then begin a journey on Branch, where we ask them questions about their pain, maybe some traditional questions they've had in the past, like medication usage, sleep interference, but then we also gather passive insights about how their pain is impacting their day-to-day life. And we create a Branch score, which is pretty much a combination of comfort score and a pain score. And then we utilize that information to deliver to the patient in real time responsive solutions. So in-app content across 5 categories that they can use to help them manage their pain, and a community of other patients to support them, really to provide the emotional behavioral components of chronic pain care that the clinicians can deliver. And then what the clinicians get in return is a new revenue generating tool using existing CPT codes, but also the ability to better manage a larger swath of patients remotely, and then better, more efficiently handle inpatient care. So that way a pain clinician, instead of seeing 38 patients a day, could actually see closer to 60 patients a day, or the 38 patients that they're seeing could be for more procedures or things that are more specialized to what they're trained in. If we want to hone in on one of the more specific concerns that health systems in particular are facing, is that they know, and even healthcare providers, right, that there are huge swaths of their population, so like say 11,000 patients or 17,000 patients within their system, that have really high morphine equivalency levels that pose enormous risk and cost to them, and yet they have very limited resources in which they can transform that type of care. And so one of the things that has been introduced are these opioid tapering programs to reduce the morphine equivalency level amongst those patients, to then bring them to levels that are safer and less risky and still have the same outcomes. But normally systems have maybe one pharmacist associated with this, or that's being put on top of the pain clinicians who are already overburdened. And so what we found is that by pairing our platform branch together with the traditional standard of care, so without putting another pharmacist or something on that, we're able to help decrease opioid levels. In fact, 30% of our users were able to decrease or stop opioids completely within 3 months of just using our platform. So we're able to accelerate and then sustain opioid tapering initiatives without health systems taking on additional burden, FTEs, risk. In fact, actually creating new revenue for their systems and being able to deliver that care that scales. We are embarking on our seed round right now in terms of fundraising. We just received funding from Hearst Labs, close, I guess, called pre-seed, which has allowed us to significantly scale our team. Going to hit 12 people by the end of the year, and then really grow revenue. So we should be at $1 million in ARR by the end of this year, and then really looking to hit $8 million by next year. Mostly through strategic relationships with health systems and multi-provider specialty groups. We are, in terms of transformative, really solidifying the IP around our pain and comfort score, and then being able to penetrate more health systems to be able to deliver our solution to more patients and change more lives. So really, we are a chronic pain platform, not a chronic care platform. So where we are looking to really move the needle and deliver changes in the space of pain. And what we envision is that every type of clinician, regardless of their specialty, when they're introduced to a patient with chronic pain, or they suspect of having chronic pain, will deliver our platform as a first step. And then use that longitudinally over 6 months or so to better understand the patient's experience with pain, and then find the right course of treatment for them based off of that personalized experience. And then also be able to deliver a myriad of treatments remotely that the typical health system or healthcare provider can't offer the average patient. So that you're not just offering them one solution for their problem, but a multiple of solutions all in one platform.